Welcome to Doctor's Verse. We explore intriguing medical cases and challenge your knowledge with our curated videos. We bring you real-life scenarios to test your understanding for exams. So prepare effectively for all your medical exams by delving into these scenarios. Enhance your understanding and boost your confidence with our comprehensive case studies. Join us on our journey to excel in the world of medicine. Let us begin.
A 40-year-old previously healthy woman, a non-smoker, had episodes of fever, non-productive cough, and dyspnea over the past 3 months. Her symptoms disappeared after month's vacation, but she reappeared when she returned home and took care of her canaries. On physical examination, there are no abnormal findings. A chest radiograph shows fine diffuse and nodular infiltrates in all lung fields. Her disease is most likely to be produced via which of the following mechanisms?
Option A is the right answer. Anterior cerebral artery would most likely affect which cortical area? Option D is the right answer. A female came to emergency with complaints of chest pain, dysphagia, vomiting, and difficulty in belching. ECG normal and chest X-ray shows air fluid level in esophagus. What are the likely diagnoses? Option B is the right answer. An elderly man is seen in the emergency room with acute moderate diffuse abdominal pain. Acute pancreatitis is suspected clinically. The laboratory tests most valuable in establishing the diagnosis would be: Option C is the right answer. Actin binds to the Z line by A. Actinin, B. Fibrilin, C. Troponin, D. Myosin. Option A is the right answer. ADH mainly acts on Option C is the right answer. Significantly raised AFP is characteristic of A. Colonic carcinoma, B. Hepatocellular carcinoma, C. Gastric carcinoma, D. Bronchogenic carcinoma. Option B is the right answer. A 35-year-old lady diagnosed case of malignant cell lymphoma prevented with cervical lymphadenopathy. Which immunological disorder she is most likely to have? A. Rheumatoid arthritis, B. Polyarthritis nodosa, C. SLE, D. AIDS. Option D is the right answer. The major difference between anaphylactic and hypovolemic shock is A. Cardiac output, B. Vasoconstriction, C. Peripheral resistance, D. Ink urine output. Option A is the right answer. Short-term transient action of angiotensin II is A. Salt retention. B. Vasoconstriction. C. Diuresis. D. Thirst stimulation. Option B is the right answer. Right atrial pressure, when increased by balloon angioplasty, results in increased release of A. AT2, B. ADH, C. BNP, D. ANP. Option D is the right answer. Development of anterior pituitary gland from A. Rathke's pouch from diencephalon, B. Evagination from telencephalon, C. Evagination from mesencephalon, D. Outpouching from stomodium. Option A is the right answer. Which one of the following acts directly on thrombin, independent of antithrombin 3? A. LMWH, B. Unfractionated heparin, C. LMWH and heparin, D. Bivalirudin and argatrobin. Option D is the right answer. A boy fell off from his cycle while riding. He presents 2 days later with complaint that he is unable to pass urine. Which structure has likely been damaged? A. Ureter, B. Kidney, C. Bladder, D. Urethra. Option D is the right answer. S2 heart sound produced by A. Closure of mitral valve, B. Closure of tricuspid valve, C. Closure of aortic plus pulmonary valve, D. Isovolumetric contraction. Option C is the right answer. A known case of left ventricular hypertrophy presented with significantly increased end diastolic volume, increased pulmonary wedge pressure, and increased aortic pressure. There was early diastolic murmur with BP 145/40. What is the likely diagnosis? A. AR, B. Tricuspid insufficiency, C. MS, D. AS. Option A is the right answer. The term aplasia describes A. Failure of cell production, B. Decreased cell production, C. Absence of organ development, D. Decrease in cell size. Option A is the right answer. Aspirin toxicity should be treated with A. NH4Cl, B. Bicarbonate, C. Diuretics, D. IV hydration. Option B is the right answer. A 30-year male came to a consultant clinic with history of progressive right facial numbness and headache for 3 months. On examination, facial nerve palsy was confirmed on right side, along with 8 nerve involvement of same side and right side intention tremors. The most likely site of lesion is A. Pons, B. Right lobe of cerebellum, C. Cerebellopontine angle, D. Right side of midbrain. Option C is the right answer. Early stages of Askoff body exhibit A. Giant cell formation, B. Fibrosis, C. Fibrinoid degeneration. D. Epithelial cells. Option A is the right answer. A 50-year male presents with jaundice. Labs shows increased AST, and liver biopsy reveals presence of Mallory bodies. These findings are highly suggestive of which disease? A. Viral hepatitis. B. Alcoholic cirrhosis. C. Alcoholic hepatitis. D. Alcoholic fatty liver. Option C is the right answer. Most common manifestation of autoimmune disease. A. Fever. B. Myalgia. C. Arthritis. D. Hematological changes. Option D is the right answer. COPD, no metabolic disturbance, partial pressure of carbon dioxide is 80. What will be the pH? A. 7.5. B. 7.6. C. 7.3. D. 7.4. Option C is the right answer. A man with normal hearing cannot recognize the direction from where sound is coming. A. Medial superior olivary nucleus. B. Primary auditory area. C. Lateral superior olivary nucleus. D. Medial geniculate body. Option D is the right answer. A patient has HB6, platelet 450K with hypercellular bone marrow. Diagnosis is A. Iron deficiency anemia. B. Leukemia. C. G6PD. D. Acute blood loss. Option A is the right answer.
Thank you for watching. If you enjoyed this content, please consider like, subscribe, and sharing it with your friends. Your support means a lot to us.